I hope you heard that. Beautiful. Hello everyone, welcome to the video again. Today we have Mr. Panchal who has come all the way from New Delhi. He is a businessman and their company basically deals with healthcare professionals equipments, and he will give you a little bit of introduction about himself and his company.
Myself Piyush Panchal. I'm from Biomerit International Private Limited, and we are manufacturing and developing some chiropractic and osteopathy equipments in India, and we have other physiotherapy equipment also. This is our catalog. And as sir told us that since I was coming to Kolkata from Delhi, so I had an issue in my ankle during a walk.
When he was coming to Kolkata during his airport checkout, he twisted his ankle. Together we have developed chiropractic drop table. We are currently in the process of development of a peripheral drop that we are going to show you, especially for the professionals, healthcare professionals who wants to get everything. और अगर आपको ये सब चीज लेना है, उनको कांटेक्ट करना है, the links will be in the description box. They are very kind. They have a extremely strong after sale support. So without further ado, let me see what actually happened to his right ankle. So what he said is he basically twisted. राइट एंकल जो है वो ट्विस्ट हो गया ऐसा करके, एंड ही इज हैविंग अ लिटिल बिट ऑफ अ पेन ऑन द राइट साइड. यहां पे आप बोले थे, करेक्ट? So right over here he has the pain. So I'll show you anatomically as to what that means. जो आप देख रहे हो, this is basically the right foot, दाहिना पैर. तो उनका जो चोट आया है वो अंदर के तरफ आया है, which basically means that this ligament, anterior talofibular ligament, that probably has got a little bit of injury. So Mr. Panchal थोड़ा सा चलिए, आपका देखते हैं हम आप कैसे चल पा रहे हैं. तो दर्द के लिए वो राइट फुट में वजन नहीं डाल पा रहे हैं. 0 बीइंग नो पेन, 10 अगर मैक्सिमम दांत उखड़ने टाइप का पेन है, तो कितना अभी दर्द कितना आप बोलोगे?
Around 5.
5. Okay, so he has probably a medium grade of pain. There is a little bit of swelling as probably you are noticing right over here, यहाँ पे. So we will try to use the peripheral drop that he has actually got for me for a demo purpose, so that we can do it better, and you will also get to see probably for the first time in India then how the peripheral drop is used to correct मोच हो या कोई injury हो, ankle joint, foot joint. तो आप देखते रहिए. Alright, so we will try to reduce the inflammatory response a little bit over here by using this flat hammer. Very light stroke. It is good that if I am doing the stroke from top down towards the center, थोड़ा सा दर्द उनको हो रहा है, because दर्द तो है, as he said around 5-6 के आसपास दर्द है. We will not go too far down. It is not mandatory because उनका जो सूजन है यहीं पे है. So we will try to use a little bit of percussion that to help relieve again the joint spasm, or right, because of soft tissue. क्योंकि ये last 24 hours में हुआ है, so we have to be extra cautious and careful not to injure the area. And yes, this is a new percussion for me. It is used, these heads can be used for multiple purpose. I am using this for to reduce the or to release the soft tissues in and around the foot. A little bit of foot, because foot intrinsic muscles जो होता है वो tight हो जाता है due to inflammatory response, and we will try to relieve the spasm. And it's tingling also, that's what he is saying. गुदगुदी हो रहा है. This is my new hammer, and this is also a little bit of a new modified type of chisel that I will be using for peripheral joints. Mr. Panchal, no problem, right? Okay, thank you. Very slowly. So now we'll be using some chiropractic techniques to relieve the joints, and जो भी misalignments हैं, we'll try to align them. I hope you heard that. tibiofibular. Beautiful. Talus. थोड़ा सा और talus. Lovely. And cuboid. And a little bit of phalanx. All right. So now, what the time that you are been waiting for, we will be using the peripheral drop table that Mr. Panchal and his company and us are trying to create for whoever is qualified healthcare professionals. If you want to get it, do contact them. ये जो है, this is called the peripheral drop. We use it for ankle and foot and also for wrist and hand joints जो है. So we will use this on Mr. Panchal's foot and ankle to again recreate the alignment which was there prior to the injury, so that the injury that is present will heal up faster. We will do the distal tibiofibular joint. You can do it couple times, maybe 3 or 4 times, depending on the type of injury and what you think is required for the bone to get it aligned. ये हो गया distal tib fib. We will do the calcaneofibular joint or talocrural joint sometimes, as you all call. Because as you know, navicular is in the medial side and navicular drop can create foot drop. So post treatment, after treatment, we will see how Mr. Panchali is walking and then we will be able to ask him as to how much pain he is having. So अभी भी थोड़ा सा है, हमको देखने से ही लग रहा है, but we will keep it, we will do some icing and he'll be fine. मिस्टर पंचाल, पहले आप 5-6 के आसपास दर्द बोले थे, अभी चलने के बाद आपको कैसा लगा? कितना आप बोलोगे?
अभी बहुत अच्छा, it's lot better.
Okay. How much would you grade it?
Around 1.5.
1.5 के आसपास. ओके, वेरी नॉमिनल पेन है, बट आप उनका स्वेलिंग अभी भी है, सो आप थोड़ा आइस लगा लीजिएगा. सो रफली अबाउट लेट्स से 20-25 मिनट्स दिन में 3-4 बार, देन आई होप दैट इट विल बी फाइन. बट आप अगर जर्नी ज़्यादा करोगे तो एक एंकल बाइंडर यूज़ कर लेना. सो वी हैव आस्क्ड हिम टू आइस दैट एरिया एंड इफ यू हैव एनी sprain or strain in and around the foot and wrist and hand, ice is always the best. And remember to put an binder या wrap या crepe bandage जो भी हो to stabilize that area, ताकि ज़्यादा pressure ना पड़े. Don't give too much pressure for about 6 to 8 weeks and then it will heal by itself and then you'll be as normal as before. Alright, thank you so much again for being with us. Again, don't forget to, if you want any kind of equipments for osteopathic chiropractic stuff and the drop table that both of us have created or the peripheral drop that we have just shown you today, remember to head on to Biomed Incorporated. Their link will be down in the description and you can get all the stuff that you want from them.
You can also visit us at www.biomedindia.net.
Okay, www.biomedindia.net उनका website है, but that website also will be given in the description. So don't forget, rush. All right, thank you so much.